We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we talk about the latest trending medical headlines and celebrity health news. I am, of course, your host, Dr. Frita, and we've got a power-packed show for you today. We're going to start off celebrating March because March is National Kidney Disease Awareness Month, and I am a board-certified kidney doctor. We'll open up with the celebrity story of Billy Porter. He has been very transparent, and he shared that he had a kidney stone that got trapped in his urethra. We'll talk about what that is, sent him into urosepsis, an overwhelming infection, just from a tiny little stone. He actually said that he passed away several times. So it sounds like he coded. Very serious. We'll talk about his case in particular, and then what you need to know about kidney stones on this Kidney Disease Awareness Month. And then we'll talk about Trump. Trump, you may have seen, had quite the interesting rash on his neck this past week, this big red rash. It was kind of crusting, and his doctor gave a bit of an explanation. But of course, I used my medical knowledge, and I have a pretty good idea that I know what it is, even if I don't, because I'm not his doctor. Let's use it to talk about what could a red rash on a neck be, and very importantly, how you can protect your skin and prevent what the worst case scenario could be. And then as we continue with this weekly dose, where I give you a fresh take on the medical headlines you simply can't get anywhere else, we'll talk about Ray J. Do you have love for Ray J? Well, his mother definitely does, because Ray J and Brandy's mother, Mrs. Sonia Norwood, came to the front to say her baby, Ray J, is not kidding around about his heart condition. It is very serious. She shared that he has cardiomyopathy. What is cardiomyopathy? We'll talk about it. I'll give you the signs and symptoms, the causes, the risk factors, and what you can do to prevent it. And then we'll play my favorite little game, Myth versus Fact. And March is also Multiple Sclerosis Awareness Month. We'll talk about Christina Applegate and the interview that she had. She had a couple of them, The View, Good Morning America, talking about living with multiple sclerosis. And we'll continue to educate ourselves with a little game, Myth versus Fact, where we'll clear up some more information when it comes to MS. Then I'll give you a second weekly dose of the headlines in medicines you simply can't get anywhere else. And we'll talk about sugar. I don't mean sugar like a sweet kiss. I don't mean like somebody who's sugar and spice and everything nice. I'm talking about sugar in foods and drinks, because RFK Jr. has come to the front. And y'all know I like to tussle with him, but we just might be on the same page, or at least close this time, because he is talking about Starbucks, Dunkin' Donuts as well, and how they have astronomical amounts of sugar in their drinks. Is this ethical? Is it up to the companies to decide how much sugar we have, or is that our own business? Well, we'll talk about it, sugar and how it affects your body. What can we do about it? And then we'll talk about Britney Spears. It's Britney. Oops, she did it again, because she was arrested for a DUI, and she has been reported to have a suspected use of polysubstance use. They think there was a combination of substances plus alcohol that led her to driving erratically and speeding. Yeah, she got arrested. So we'll talk about that. And very importantly, we'll talk about the dangers of mixing substances and medications and pills with alcohol. It's a big deal. Of course, this is a live show, and so you can ask me questions, but I'm going to ask you questions too, okay? We will see each other. But let's go ahead and get started. Give us a like, give us a follow, give us a subscribe, because I'm Dr. Frita. I'm giving you evidence-based medical information, and this is Dr. Frita Live. Welcome, welcome. I'm Dr. Frita. This is Dr. Frita Live, and we're about to get this thing going, but I'm not doing it on my own. Y'all know that. I'd like to welcome my co-host and my office manager of 13 years to the stage, Miss Shador. How are you doing, Shador?
Hey, good, Dr. Frita. How are you? How's everyone?
Everyone is doing well. Everyone's doing well. We are making it. We are making it like all families. You know, things pop up. We all have things that we have to go through and live with, but yeah, everything's gonna be all right. How are you doing?
I'm doing pretty good.
Good. You had a good weekend?
Yeah, I think I had a pretty good weekend. T-ball started up, so
T-ball.
First practice. I can't say this practice started how last season ended as far as the game. So we'll see.
Oh
Fingers
boy.
crossed.
All right. Does your little one seem like he's going to be in it to win it? No,
Yeah,
he sounded like
he's anticipating this year, so he's actually participated
okay.
in practice and was excited. So we'll see if that continues.
Very good. Very good. All right. Well, let's just go ahead and jump in because we definitely have a lot to talk about. March is Kidney Disease Awareness Month. I do want to know, Shador, who was the first one in the chat?
First in the chat today is Miss Aileen.
Hi, Miss Aileen. Welcome, welcome. How are you doing? All right. Well, Miss Aileen, I know
members
you
in
always
the chat now can Frita as well.
What's that?
Have a couple members in the chat also.
Come on, members. Where are y'all?
Miss B. Will.
Hey, Miss B. Will. Thank you for being a member.
And Randy, Mr. Randy.
Hi, Mr. Randy. Thank you so much for your support and being a member. All right. And for my members, listen, I just posted this morning a couple of members videos. For all of my members, I give you a healthy habits quick tip. And I'll be doing that pretty frequently this month, just for Kidney Disease Awareness Month. And then for my members, my resident members and above, I have another members only video that I did for you today. And I talk about some pretty deep stuff, I'll tell you, but make sure you check that out after you finish this live. And for anyone who's listening, if you want to become a member, please do. You can click the link in my description. And of course, you can always go to my one-stop shop, drfrita.com. But for the membership, you get special shout outs, of course, special emojis. But I also have members only videos where I really do some deep dives and I give you videos throughout the week. And then if you're a member at the highest tier, once a month, we have a members only live Q&A where instead of me just talking and walk it like I talk it, I actually listen and you can ask me questions about yourself, about medical information, about family members, about your neighbor Sally down the street. If you saw a lesion on her leg and you want to sit and break down what it could possibly be, but it's your chance to have full access to me. And for those who are new to me, I am Dr. Frita. This is a Dr. Frita channel. I'm very excited that we have over 970,000 subscribers. Thank you to all of you who support. If you're not a subscriber, please go ahead and subscribe because we have hundreds of videos and I give you evidence-based information. I am an MD. I have been quadruple board certified. I'm a board certified nephrologist, meaning I'm a kidney doctor and high blood pressure doctor. I'm also board certified in internal medicine. I'm board certified in obesity medicine. And after I completed my MedPeds my MedPeds residency, my dual residency at Georgetown University Hospital School of Medicine, I received my board certification in pediatrics. And so I love to learn a lot. I read medical journals every day, no exaggeration. More importantly, I love to share my knowledge with you. If you subscribe, then you can have a bit of the knowledge. And of course, participating here on live stream events, we get a chance to go back and forth. So let's go ahead and go forth. And let's talk about Billy Porter. You know, Billy Porter, he is a Broadway star. He's now a director. He's a huge personality, Billy Porter is. A lot of personality. Okay, you may have seen him recently when someone asked him what he thought about Nicki Minaj, and he gave some quite famous dramatic words. Well, now he's come to the front. He did an interview, and he shared that he really almost passed away. In fact, he describes it that he passed away several times, meaning he likely coded, meaning he probably went into cardiac or pulmonary arrest. I'll let him tell it, and then we'll talk about it on the other end. All right, let's hear what Billy Porter says about his kidney disease situation.
There's news on 2017 GLAAD honoree Billy Porter getting emotional while reliving the sepsis battle that put him on life support.
I was dead for 3 days. I am a miracle. I'm a walking miracle.
It all started with a simple UTI last spring, which then led to a painful kidney stone infection by the fall. But then
I checked myself into the hospital because I'm in so much pain. Saw that the kidney stone was trapped. There was so much infection. I went uroseptic in minutes.
Billy had to drop out of cabaret on Broadway, revealing on the Outlaws podcast he also almost lost his leg.
They had to cut me open on either side of my leg while I was in a coma so they could save my leg.
You good now?
I'm good.
Okay.
I'm good. I'm getting there. Not 100% yet, but I'm getting there.
I love how he shares. Very good. In the chat, I want you to please put and give me a musical note because he's a musical man. He was doing cabaret. Give me a musical note, and I want you to tell me what you think some risk factors for a urinary tract infection are. He said that he had a UTI, urinary tract infection. I want you to tell me that. And then in honor of Kidney Disease Awareness Month, I'm going to talk to you about kidney stones because he described having a kidney stone that was trapped and a UTI. And so we'll talk about what that connection is, okay? And so a kidney stone. So a kidney stone is when you have crystals that actually are in the urine and then they bind to each other to form a stone. It's like it sounds like it's literally a rock in your kidneys. It's a kidney stone. And once you get a kidney stone, it can pass on its own, which is what you would hope for it to do. When it passes on its own, it can be quite painful as it scrapes down the inside walls of your kidney system. But if that kidney stone is too large to pass, then it can become trapped, the way that Billy Porter's became trapped. And when that happens, you can get a backup of urine. And when that urine is just sitting there sedentary in your bladder or in your ureter or in your kidneys, then it can lead to a severe infection. And he described having all kinds of pus, okay? And his whole body became infected. And so what starts off in the urine as being a local urinary tract infection can spread to your whole body. And that's called sepsis when the infection gets into the bloodstream. And he had urosepsis or sepsis from a UTI. And it can really lead you to be severely ill because when you have sepsis, this infection, this overwhelming infection, it can cause your body's systems to go all out of whack. It can cause you to have a failure of your cardiovascular system, meaning that you can have a severe drop in blood pressure. You can go to septic shock, okay, requiring you sometimes to be on artificial medications, artificial drips through the IV to keep your blood pressure up. You can go into respiratory failure, okay, requiring mechanical ventilation, a breathing tube, okay. You can get kidney failure. You can have all kinds of issues, all starting from something as what seems to be as simple as a urine infection. And so how are these things related? Well, you wonder what came first, the chicken or the egg. There are different types of kidney stones. There's one type of stone called a struvite stone, and it often comes from people having repeated urinary tract infections. The most common stones are calcium oxalate stones, but then so the urinary tract infection can increase your risk for kidney stones, for a struvite stone. But then if you have a kidney stone that is blocking your urinary system, like what Billy Porter described, then that blockage can cause a UTI. So what came first, the chicken or the egg? They're related that way. And so I'm going to see what you all say as far as in answer to my question. And then we'll talk about kind of some signs and symptoms, how to recognize UTIs and kidney stones, and most importantly, when to contact your physician. Did anyone comment?
Yeah, absolutely, Dr. Frita. YouTube butterflies, blue butterflies.
Hi, blue butterflies. Thank you for joining us.
Dehydration.
So dehydration can put you at risk for both. So as far as kidney stones, I mentioned that you have different crystals, okay, like different particles that have to meet each other to stick together to form a stone. Well, if you're very, very hydrated and you're drinking a lot of water, that means you have a good urine flow, and you might have a lot of particles in your urine, but if you're hydrated, it's hard for these floating particles to find each other, right? But if you're dehydrated, like what blue butterflies are saying, then if you're dehydrated, those particles become more concentrated and they can find each other and stick together. So being dehydrated is a huge risk for kidney stones. It can also be a risk for urinary tract infection because if you're dehydrated and the urine's just kind of sitting there, concentrated, sloshing up, and it has bacteria, they have more time to sit and multiply in your bladder if you don't have a good urine flow from hydration. So being dehydrated can put you at risk for kidney stones and UTIs. Come on to the front of the class. Thank you. Anyone else?
Yes, Miss Aileen says poor hygiene.
Poor hygiene. So that's as far as the urinary tract infections. So if you, for example, have a lot of stool or soil and you don't change, you're not cleaning the stool off of your perineum. Okay, when I say perineum, I'm talking about your area of your genitalia, like your undercarriage or the part of your body. If you were to sit on a saddle, the part that covers the saddle, that's your perineum. And that's like that area, your genital urinary area. So let's talk about women. So for women, you're dealing with the vagina there, the urethra, which is the urine hole. You have the anus there, all of those things. If you are someone who does not have good hygiene, and if when you urinate, you wipe from back to front, where you're pulling what's going on at bowel movements up to where your urine tube is, the urethra, that could put you at high risk for urinary tract infections. That's correct. Men also, if you, especially for example, if you're an uncircumcised man and you don't pull back the foreskin. I hope I can say all this on YouTube. It's just science. It's just science, everybody. So if you have a lot of bacteria and it sits there and it collects at the urine hole, that urethra, then that could put you at a higher risk for urinary tract infection as well. Also, for someone who is, say, elderly in a nursing home, or someone who is not mobile, if they depend on other people to clean them, and they have, adult like Depends or adult diapers, if they're not changed frequently, and if they're just allowed to sit there in their own soil, okay, like their own bowel movements, then again, the bacteria from the bowel movement can crawl up into the urethra, the urine hole, and go into the bladder. Okay, so yes, having good hygiene is a way to help to prevent urinary tract infections. And just reviewing the anatomy, you have your two kidneys. They're like in your lower back where your flanks are. And then the tubes that connect the kidneys to the bladder are the ureters. And then you have the bladder right in the front, like when you feel like you're full and have to use the restroom, your bladder is full. But leading from the bladder to the outside world is a tube called the urethra. Of course, it's short in women, but in men, it has to go all the way through the male organ. So that's the urethra. When we talk about it, and again, Billy Porter said that his urethra had a blockage from a stone. Okay, anyone else? And then we'll just kind of get into how to prevent and when to talk to your doctor.
Yes, Purple Onion says
Purple Onion,
holding your urine for too long. So holding urine for too long.
Okay, so holding that urine, good, because that gets into you're creating your own blockage, right? If you're holding your urine for a long time and it's stagnant and it's sitting there, it's kind of like if you have water in a sink and you just leave it there for days and days and days and don't drain it, it can collect bacteria, it can collect whatever else is going on, and it doesn't flush through. So yeah, holding your urine really could increase your risk for urinary tract infection. Good. Okay. All right. So women tend to get more urinary tract infections than men just because we have that short urethra. And it's easy for bacteria to get up there to the bladder. But men tend to get kidney stones more frequently than women. Haha, payback. At any rate, make sure that you stay well hydrated, you consult with your doctor, you maintain a low salt diet. Even though I mentioned that the most common kidney stones are calcium oxalate, you want to have a diet that has normal amounts of calcium. If you try to cut back the calcium in your diet, it sounds counterintuitive, like it doesn't make sense. But if you try to cut back the calcium in your diet, that can actually worsen your risk for kidney stones. But as far as calcium supplements, you do want to limit your calcium supplements. But as far as whole foods that have calcium, please don't cut those back. As far as preventing kidney stones, yes, stay very well hydrated and listen to your body. If you're having fever, if you're having blood in the urine, if you're having pain in your kidneys, if you're having pain in your bladder, please don't ignore it. And don't say, oh, I'm too busy to be sick, because everyone's kind of too busy to be sick. And I know Billy Porter is working, booked and busy. He's too busy to be sick. But if you ignore those early symptoms, then you can end up passing away, okay, or in an ICU. So definitely pay attention to your body, and wishing Billy Porter the absolute best. And for just today, as we move on, well, for the rest of the month, this Kidney Disease Awareness Month. If you have a specific kidney question, just put an orange heart in the chat. We'll give members priority, of course, Super Chat's priority, and we'll see what we can get to as we go through the show. So give me an orange heart if you have a kidney question. All right. Please give us a like, a follow, a subscribe. Please share, let folks know we're here. It's a way to let YouTube know that we're here and we're giving evidence-based medical information. All right. Let's talk about Trump. Shall we? We shall. He had a neck rash, this red, kind of angry looking rash on his neck that folks were asking questions about, myself included. In fact, I was on the Don Lemon show last week going into detail, and I did a short form content on that. You can check that out here on YouTube and on other social media platforms after we finish here, talking about what in the world is that red rash on Trump's neck. Well, let's go ahead and play the clip, and then we'll talk about it.
It was a moving moment. President Trump giving out medals of honor to military service members, but eagle-eyed viewers zoomed in on this, a rash on the president's neck. So what is it?
What's that on President Trump's neck? There are renewed concerns about his health after photos show a red rash on the side of his neck. The skin condition was first spotted on Friday in Texas when he appeared with the actor Dennis Quaid. But the rash worsened on Monday at a Medal of Honor ceremony at the White House. So what is it, and is it serious?
The rash is most likely caused from a cream that's a chemo cream.
We spoke with dermatologist Doris Day, who says the president is most likely using a chemotherapy cream, which is used to treat precancerous skin cells due to sun damage.
It's
Very
very
good. Okay.
common for the reaction to this cream to
Okay. So yes, and it's interesting because the president's doctor, Dr. Barbabella, came out and said, "Oh, you know, the rash is from a preventive skin cream," but he never said what the illness was. And so that's good to see that a dermatologist, I'm on the same page with her. When you think about a cream for a skin lesion, most creams are to treat the skin lesion, right? But in his case, this cream is to prevent the skin lesion. And so that would narrow it down. And there is a cream, a chemotherapy cream called 5FU, and it's used to prevent precancerous skin lesions, something called actinic keratosis. And Shador, if you could pull up the picture of actinic keratosis. So yeah, that's little abnormal markings on the skin. It's not quite cancer, but if allowed to progress, actinic keratosis can turn into squamous cell carcinoma. So the 5FU, that skin cream, is something that can prevent something like this. So perhaps Trump had this. And then it can also help to treat basal cell carcinoma, which, so here's basal cell carcinoma. It is a skin cancer. It is pretty slow growing. It typically does not metastasize, and it's the most common skin cancer. And in fact, it accounts for 80% of non-melanoma skin cancer. Survival rate is practically 100%, the 5-year survival rate. Patients do very, very well. So most likely, given it's a preventive cream, that's what it most likely would be. To my knowledge, they still haven't shared exactly what it is. I don't know why. Perhaps he thinks that having cancer, that big scary word, is a form of weakness, but actually he could use this huge platform to share information. But that's okay. We're going to use our platform to share information because it is important, especially if you're at high risk for skin cancer, that you get regular skin checks with your dermatologist. So how do you know if you're at high risk? If you have a lot of UV light exposure, sun exposure, like if you're someone who plays golf. Also, if you have fair skin, if you don't have a lot of melanin, okay? So if you're rather pale, even if you seem like you're orange, spray tans are not a replacement for melanin. And so if your baseline skin color is pale, if you're pale under your eyes or behind the ears or places where the spray tan does not get to, you're still at high risk. Also, older people over the age of 65 are at a higher risk for getting skin cancer, basal cell carcinoma, actinic keratosis. And the thing about this cream, this preventive cream, it will cause redness. And then as the weeks go on, the rash gets even redder and starts to crust over, which is what it looks like happened with Trump. Again, I'm not his doctor. They have not confirmed that that's what it is, but you know, at least we're sharing as far as the natural history of what they're describing, what it likely would be. No, it doesn't sound like he has melanoma. It doesn't sound like he has the more deadly skin cancer. It sounds like either he has a precancerous lesion, actinic keratosis, or perhaps basal cell carcinoma. Yeah. So that is that on Trump. So I do want to ask this question. I'm just curious. How many of you really pay attention and you do skin checks for your body? And be honest, if you don't, if you think, hey, you know, I'm at low risk, I'm not in the sun, I have a lot of melanin, just tell me. If you're someone who does skin checks, just put yes to the skin in the chat. I'm just curious. And I do want to remind you that even though if you are a darker person, if you have a lot of melanin, you might not be at high risk for typical skin cancers, you know, for that you're at risk for from UV light. But do remember, there is a bit of a rare melanoma, specifically that type of a skin cancer, and Black people can get that as well. No, the sun exposure itself is not so much what puts you at risk, and that skin cancer, well, often the melanomas might show up under your fingernails, under your foot, and your toes, even inside in mucous membranes. And you might recall the singer who passed away from this type of a melanoma, a Black singer, a Jamaican singer. If you know who I'm talking about, put it in the chat, which singer passed away from melanoma, a Black singer, a Jamaican singer. Just to remember, regardless of what color you are or the risk, just kind of pay attention to your body, okay? Look at your skin, look under your feet, get the mirror and contort yourself however you have to do. Look at all of your body. I mean, all of your body parts from the rooter to the tutor, so you can know if there's a difference or a change. All right. Anyone say they check their skin, Shador?
Yes, a few people say they do.
Okay.
TT
Hi, TT.
says yes.
Very good.
Adija says yes.
Good.
Mary on Facebook Says,
Hi,
yes.
Mary. Hey, welcome from Facebook. Mary, I put a lot of stuff up there for y'all this weekend. I did a Britney Spears short form content. I did a Kidney Disease Awareness Month for short form content where I give you the 11 early warning signs of kidney disease. And then I feel like I did something else. But yeah, but thank you for joining from Facebook. Real good.
Raven says, yes, but not enough checks because I have many skin tags and moles.
Oh, and see, you got to be careful because when is a mole just a mole and when is it something like an actinic keratosis? So if you don't already see a dermatologist, I would recommend that you see one and they can give you a schedule. They might even want you to come in once a year for a complete skin check. I mean, between all the cracks, crevices, everywhere is very important because that's something that you can prevent or at least catch early if it were to change. Yeah.
All right. And to answer your question, Dr. Frita, the famous singer, Lisa chimed in.
Hi, Lisa.
Lisa, Eunice, but Eunice chimed in first with Bob Marley.
Eunice and Lisa, thank you. Absolutely. Bob Marley, Black man, locks, legend, of course. It was melanoma. And it was one of those acral lentiginous melanomas, not just a typical one that you would get on sun exposed skin. It was down like on his foot or under a fingernail. So everyone needs to pay attention to their skin. All right. So let me ask you this, and y'all please go ahead and give us a like, and just remember, we are here for the live, but also we have hundreds of videos for you to check out. And if you enjoy having this medical evidence-based information live, wonderful. But if you want to talk to me one-on-one, I do offer a telehealth concierge service. So make sure you click the link in the description or visit my one-stop shop, drfrita.com. I can talk to you from anywhere in the world with this telehealth series. And what I do is just one-on-one, one at a time. And I take a full history and we can literally talk about second opinions, first opinions. You can ask me about family members. You can just take advantage of all of the knowledge that I really enjoy acquiring. And I can just give you a real, one up close view and recommendations and information just based on our conversations. So I'm having really good success with that. And literally, I'm talking to people from all over the world and having very good success. So yeah, so please join for that, the telehealth concierge. All right. So now let's talk about Ray J. I know we talk about Ray J a lot here, but it's just because he's so young, in his early 40s, and he came out to the front and shared that he had, at first he said he was about to pass away. He didn't have much time left. Then he said his heart was working at 25%. Then his eyes were bleeding. And Ray J is, someone who is a very talented person. Also, he plays a lot. And so you had people who were questioning him. And so his mother, Mrs. Sonia Norwood, came to the front and she actually did a live to let us know her child is not kidding around. And actually, when she first learned of his cardiomyopathy, his heart disease, his heart was not functioning at 25%, that ejection fraction. It was only between 15 and 20%. And so let's go ahead and see what Mrs. Norwood, Ray J's mom, had to say. And then we'll come back and I'll talk to you about what it means to have a cardiomyopathy.
Really gotten out of hand when someone thinks that my son is faking his health, or it's a hoax, or he's just playing around. He's not really serious about it. So for all of you who have been genuinely concerned about him and genuinely prayed for him, I want to say I thank you very much for that, because it takes multiple prayers and thoughts. And I'll start off by saying that never in my lifetime would I had thought that there would be someone as close to us who would experience some type of heart condition. And on January the 6th, 2026, I received a phone call from Ray's friend Truth in Vegas. And the text basically said, Ray is in the hospital. My kid is in a life-threatening situation, meaning he could have a heart attack. As a matter of fact, we were told that if he had not checked himself into that hospital, that he could have had a heart attack. We were told that he still can be active. He still can engage. He still can stream. He can still act Ray J, but he has to do it with limitation.
Good. Yeah. So there you have it, confirmed. And I'm glad that when she said, at first she sounded like she was a little indignant, like she couldn't believe that someone would think her child was playing. But then she also does, I'm sure, recognize Ray J's persona and that he does play a lot. And so I'm glad that she acknowledged that. For some of us who were like, gosh, I kind of hope he's playing around, it wasn't to discredit him, but it's just like, I don't want him to have this. But unfortunately, he does have it. He has the cardiomyopathy. And what she's saying, you know, they told her that he would be at risk for having a heart attack. And that 15 to 20% that his heart was functioning at, that ejection fraction, that is a dangerously low level of heart function, which puts him at risk for having an abnormal heart rhythm, and he could have sudden death. I'm not speaking that on his life, but having cardiomyopathy with a low ejection fraction does put you at risk for sudden cardiac death. So I'm going to ask a question. I want y'all to put a red heart in the chat and answer this. What do you think the most important question is to ask your doctor during a checkup? What's the most important question to ask your doctor during a checkup? Okay, so put a red heart, and then let's talk a little bit about cardiomyopathy. So cardiomyopathy occurs when your heart muscle is stretched out and to the point where it's not working as well as it should. And so when Ray J's mom, Mrs. Norwood, talks about ejection fraction, that is how much blood is being pumped out of the heart with each contraction, specifically out of that left ventricle, that particular chamber in the heart. It's normal for the heart to pump out anywhere from 50 to 70% of blood with each squeezing of the heart, 50 to 70%. Ray J's heart, according to his mom, was only pumping out 15 to 20%. That's not enough. When you're not pumping out enough blood with each contraction, then that's considered to be congestive heart failure. There's a backup, because you're not pushing enough blood forward, and you know that your blood carries your red blood cells, and those are the little cars that carry your oxygen. If you're not pumping enough blood forward, you're not oxygenating your cells properly. You're not oxygenating your brain properly, your heart properly, your lungs properly, your legs properly, your liver, your kidneys, and it can cause multi-organ disruption, okay? Also, you can get a backup of blood in a fluid, which can lead to swelling of the feet, swelling of the ankles, even swelling of some of your organs. It can cause you to have shortness of breath. And again, with that muscle being stretched out, you are at a higher risk of it not pumping at the proper beat, meaning you can have an arrhythmia, abnormal heart rhythm, and it can even lead to a dangerous arrhythmia, like ventricular fibrillation, a dangerous arrhythmia, and you can get sudden cardiac death. And so it's very, very, very serious. The good thing is that we do have treatments, and his does seem to, you know, with that 15 to 20% that she described, and then he later described it as 25%, it is possible that he could have gotten some improvements. One, with lifestyle modification, that can help. So having a low salt diet. We know that Ray J has shared that he did bottles of alcohol, you know, and that he would do Addies. I'm assuming he's talking about Adderall. Mixing Adderall with alcohol can definitely increase your risk for heart disease. Also, if he has high blood pressure, I don't know, but if he had high blood pressure, that's a huge risk for cardiomyopathy. There are other causes as well. Once we finish this live, make sure you check out the several videos I have on Ray J. I have a long form content right here where I talk about the life expectancy of someone with congestive heart failure. I just give you the straight up medical information, okay? Just giving you the evidence-based medical information. And then I have multiple short form contents on Ray J and his words, talking about his cardiomyopathy, where I come back and I kind of give a medical breakdown. And then I also did a short form content where I broke down the Mrs. Norwood, everything that she explained, including when he had a cardiac catheterization. Okay, so I explain all of that. But meanwhile, I just want to know from you, med heads, what do you think is the most important question to ask a doctor when you go for your checkup?
Yep, we had a couple asked that question. I remember Miss B. Wellness.
Hi, Miss B. Well.
She said, I always watch my heart. I guess high blood pressure numbers. Ask the doctor, when you listen to my heart, what do you hear?
That is very good. And listen, Shador, listen, Miss B. Well, somebody got me like that, because once, so yes, high blood pressure is one of the leading risk factors for a lot of things, for heart disease, heart attacks, strokes, kidney failure, cardiomyopathy, you name it. And so it will be very important to understand your high blood pressure numbers, or your blood pressure numbers. Hopefully they're not high. And remember, even if your doctor says, oh, everything looks pretty good, if your top number systolic is 130 or higher, or if your diastolic is 80 or higher, so 130 over 80, that's high blood pressure. Okay. So please don't think that that's normal. As far as what did you hear, that's an important question because, when I go through, I listen to the heart and I know what I'm listening for. S1, S2, I'm listening for clicks. I'm listening for murmurs. I'm listening, for the regularity of the rhythm. And it's just very quick, at this point after practicing medicine for so long. But when you stop and ask a doctor, that forces them to kind of back up, explain it to you. It gives you a better understanding of what's going on with your heart, but it also communicates something. Like for me, when a patient says, "What do you hear?" I'm like, "Oh," and I'll break it down. It tells me, wow, they're really interested in their health. And then y'all know me, it don't take nothing but a thing because I love to explain health. That makes me give even more information because I know you really want to hear it. And it can really be a very helpful thing for you in understanding yourself and establishing a good relationship with your doctor. So that's actually a good question. What did you hear? I'd be like, "Oh, you want to know? Here, let's go." So good. Anyone else?
Yes, Theophilus. Hello.
Hi, Theophilus.
Theophilus asked, how's my heart? He always asks that, doctor.
That's good. And we know that heart disease is the number one cause of death, right? We know it's the number one cause of death. One person has a heart attack like every 40 seconds. And we know that cardiovascular disease in general, including strokes, number one, okay, cause of death. So if you ask how your heart is, then you are asking about the most likely thing to take you out. So to be blunt. So yeah, that's a good question.
Deborah on Facebook.
Hi, Deborah. Thank you for watching from Facebook.
She asked, "Can you check my heart today? Am I at risk for a heart attack?"
Good. And, and in doing that, hopefully that will make your doctor tell you the different things to know if you're at risk. Like they'll let you know your cholesterol numbers, your hemoglobin A1C to let you know if you have diabetes or pre-diabetes. They'll let you know your EGFR, your kidney numbers. All of these things can put you at risk for heart disease. They'll talk to you about your BMI or other ways that may be a more appropriate measure to know if you're a person who's living with being overweight or living with being obesity. All of these things can put you at risk for heart disease. So if you ask that question, am I at risk? That can take you down a whole lot of trails. And so that's good. Okay, I like it.
Our member, Joyously Hopeful. Hello.
Yay! Thank you, Joyously Hopeful, for being a member.
Her questions will be, can it reverse? And what do I need to help myself?
Very good. Control what you can control, right? Take action. And with that, beyond just medicines you're given, what can I do lifestyle-wise? If I have high blood pressure, what can I do? You want your doctor to tell you about the low salt, tell you about the exercise, tell you about, making your beet juice. Very good. Tell you about slow, deep breathing and meditation. Incidentally, right here on the Dr. Frita YouTube video, go to my playlist. I have videos on heart disease. I have videos on congestive heart failure. I have videos helping you understand a heart attack versus cardiac arrest. I have, of course, a whole playlist on kidney disease. And yay, Kidney Disease Awareness Month. So just take advantage, educate yourself. And when you watch my videos, that can also help to form some of the questions that you ask your doctor. And of course, the squeaky wheel gets the oil. All right. I like it. Very good. Anyone else before we move to my favorite game?
Yes, Pretty Jen.
Hi, Pretty Jen.
She asked, how's the ejection fraction percentage and heart rate or blood pressure?
Okay, so now very specifically, those would be questions for a heart doctor, because actually the ejection fraction is not something that's done at a routine visit. A doctor would typically order an echocardiogram if they hear something that's abnormal, like an abnormal heart murmur. Every murmur is not necessarily abnormal. There are things called flow murmurs that can be considered normal. But basically, if they hear an abnormal heart murmur, if they hear irregular rhythms, things like that, then they may initiate doing an echocardiogram. And then if you get an echocardiogram or an angiogram or a cardiac catheterization, then you'll know what your ejection fraction is. But you know what? An important question might be still, what is my ejection fraction? Because if they don't know, then you might say, well, hey, what are the indications, and would it be a good idea for me to get an echocardiogram or to have a further evaluation? So either way, your question is a good one because it will open up the question on your risks. So your doctor can tell you why they haven't ordered your ejection fraction versus you can say, I'm not speaking this on your life, but if you were to have risk factors like high blood pressure, for example, or shortness of breath, you can be your own advocate and actually request it. Say, I want to know my ejection fraction, and then have the conversation from there. So still a good question. Yeah. Okay.
All right. Thank you, Dr. Frita.
Good deal. All right, y'all ready to play a game? It's Super Bowl Monday. Okay, not really. It's just myth versus fact. We are going to play my favorite little game. And because it's also multiple sclerosis week, MS, we're going to talk about Christina Applegate. And, you know, for those of you who knew her when back in the day from Love and Marriage, her father, oh, he got on my nerves, Ted Bundy, her mom was always scantily clad with the big red hair, you know. So Christina Applegate was a star of that show. And then she's been in various movies, various sitcoms, but she's been very open that she's living with multiple sclerosis. And we know that multiple sclerosis is a neurological disorder and it can cause all kinds of issues. I will have her to explain in her own words, but first, let's go ahead and play the game first, myth versus fact. I'm going to see what my med heads know when it comes to MS, multiple sclerosis.
All right, Dr. Frita, before I dive into the first question, shout out to the newest member.
Yay!
Miss Colette.
Thank you for joining, Miss Colette. Appreciate you. Listen, I'm telling you, hot off the press, I just posted a video for you today, possibly a couple for you today that you'll see for members only. And then now you'll have access to all the members only videos we've been doing. And depending on what level, you might be able to join us for our once a month membership live Q&A. But I really do give you extra content, evidence-based content. And we have a lot of fun for the membership. And most importantly, I appreciate your support. I appreciate you because I know, look, this day and age, you can definitely do what you want with your support, with your, you know, where you choose to put your resources. I appreciate you for giving us this support. Thank you.
Absolutely. And then a quick shout out to members James.
Hi.
And Miss Sheila.
I miss she. Oh, I don't know when I'm gonna stop singing that. Sorry, Miss Sheila.
Probably never. All right.
Thank y'all for being
number one. MS symptoms can appear years before an official diagnosis is made.
MS symptoms can appear years before an official diagnosis is made. Put an M1 if that's a myth. Put an F1 if that's a fact. All right, myth versus fact statement number 2.
The main symptom of MS is trouble with walking.
Okay, the main symptom is trouble with walking. M2 if that's a myth. F2 if that's a fact. Some kind of tricky questions here. We'll see what we get. All right. And actually, while we're waiting for the answers, let's go ahead and play the clip and it might answer some of the questions for us. And then we'll get into the answers.
All right.
During the filming of Dead to Me, Christina learned she'd been diagnosed with multiple sclerosis, MS, a degenerative autoimmune disease of the central nervous system, which we spoke about 2 years ago.
My symptoms had started in the early part of 2021, and it was like literally just tingling on my toes. And by the time we started shooting in the summer of that same year, I was being brought to set in a wheelchair.
I remember asking you, were you still grieving? And you're like, don't put a timestamp on it. Where are you now with the grieving process of MS?
Still sucks, Robin. It really does. And anyone that tells you different, they're not telling the truth. I'm sorry. I have so many friends who have MS, and we talk to each other constantly. And I don't have one that says, I'm great. There is no great. There's a better day and a less day. This is a lifelong disease with no cure.
I can't stand that. I mostly can't stand the fact that she's telling the truth. Okay. There's no cure. There are treatments. There are different treatments, but there's no cure to make MS go away. So let's go ahead and see these myth versus fact. See how y'all did med heads, and I'll tell you a little bit more about MS.
All right. Statement 1 again. MS symptoms can appear years before an official diagnosis is made.
Okay. What say you, med heads?
Member Miss B Wellness says it is a fact.
A fact. You can have symptoms years before a diagnosis, okay?
Khadija says a fact.
All right.
Member Sheila says fact.
Hi, Sheila.
Daryl says a fact.
Hi, welcome, Daryl. Okay.
Eunice agrees.
Oh, gosh. Wouldn't it stop anybody? What's going on?
Freddie also agrees that it's a fact.
Hi, Freddie.
And member joyously hopeful says a fact, Dr. Frita.
You know what? Y'all think y'all so smart. And you are. It's a fact. It's a fact. Symptoms can appear years before. And I've experienced this not only with patients, and taking a history, but also with family members and friends where they were having all these non-specific symptoms that were all over the place. And you really have to be careful and advocate for yourself, because sometimes folks are quick to label you as being a hypochondriac, because it's just like, well, how are you having trouble vision, and your left hand is tingling, and you can't walk, and you're having, bladder incontinence. You're just making up stuff is what they might think. But yes, you can have symptoms years before. And even Christina Applegate shared that she was having a tingling sensation 7 years, 6-7 years before she even had a diagnosis. So absolutely, you can get these symptoms that show up way before the actual diagnosis. All right, let me see if I stomp y'all with myth versus fact statement number 2. What y'all got?
The main symptom of MS is trouble with walking.
So this is a curious question. Okay, what we got?
I think we got a mixed bag here. Let's see here. I remember Ms. Sheila says a fact.
A fact, okay.
Lisa says a myth.
Okay.
Purple Onion agrees with Lisa. That is a myth.
That is a myth? Okay.
Brenna says it is a myth.
Ooh, okay. We got a mixed bag.
Elonia says a fact.
All right, Elonia, welcome back. Okay.
I remember Joyously Hopeful also says it is a fact.
All right, Joyously Hopeful. Okay.
And member Terry says a fact.
A fact. Ooh, this is a good one. And it's actually a myth. It's a myth. To be fair, I will say that a lot of times, this is the thing about MS, the most visible symptom, what you can see, like when someone's rolling in with a wheelchair, if they're limping, you can visually see when someone has trouble walking. But what you don't know is that, for those of you who didn't realize that this was actually a myth, MS is one of those things, multiple sclerosis, where it's largely an invisible disability. And so one of the main presenting symptoms can be blurry vision, okay? When the optic nerve, the nerves that supply the eyes are affected, or you can have bladder incontinence, you can have bowel incontinence, you can just have severe fatigue. Instead of having trouble walking, you might just have numbness and tingling in your fingers, or numbness and tingling in different places. The point is that there are multiple symptoms, some of them that are not obvious, some of them that are invisible. It's the one that you see by the time a person has trouble walking, but that is not the main and certainly not the only symptom of MS. It is a part of it, to be fair, but there's much more. So this is just one of those things that help to remind us that for certain illnesses, there is an invisible disability. And so when someone tells you that they're hurting, or they tell you that they're having symptoms, please don't just look and be like, she don't like anything's wrong with her, because MS is one of those. So let's just talk about what MS is, multiple sclerosis. It is an illness that occurs when the covering of your nerve cells, the myelin sheath, is attacked. You have antibodies that will attack it, and they create these craters and dents and defects in the covering of your nerve. And then once they do that, of course, your body tries to heal. And so then you get scars on these nerves, on this myelin sheath, this covering. You get many scars, multiple scars, which is how it gets the name, multiple sclerosis, many scars. When you have the scarred myelin sheath, that means that it then interferes with how your nerves conduct, right? You get breakups, and so it can lead to tingling, it can lead to weakness. And so it can affect the nerves that go to your eyes, okay, your optic nerves, and just really anywhere in your body. And so then you can imagine not only with the motor and how you move or how you walk, but also in how you see, also your sensation, also in how different muscles contract. And so it can affect your nerves all over your body. Women tend to get multiple sclerosis more so than men. The age between 20 and 40, mostly. Interestingly, people of European descent are at higher risk than people of non-European descent, although for sure, and I can tell you, and I have patients and I have folks close to me who are Black folks who have MS also, but this just happens to be one, unlike many of the diseases, where Black folks aren't on the top of the risk for it. And, as far as there's no cure, as Christina Applegate said, there are treatments, certainly steroids, things that can help to calm down antibodies. There are different infusions that can also help to calm down antibodies. One thing that you notice for folks with multiple sclerosis, oftentimes, because they tend to have, muscle issues, weakness, and they do tend to have trouble walking a lot of times, they're not able to walk and exercise like they used to. Take that and combine it with taking steroids, chronic steroids in some cases. We know that steroids make people eat more, retain more water, retain more salt. And so oftentimes you'll see a lot of weight gain. And if you know Christina Applegate from her baseline, she was very thin in Hollywood, and now she's put on the weight and has had to answer a lot of questions about it. But that's just to give you a medical perspective of some things that are stacked up that would increase her risk for weight gain if she's on steroids, which I don't know, and if she's less mobile than she used to be, which I do know because she shared. Okay. Anyone have any comments? All right, but thank y'all. I love it when y'all participate, and this is how we learn. When we have a mixed bag and some people get it right, some people get it wrong, I actually perk up, not because I'm, evil and I want y'all to get things wrong. It just lets me know, ooh, we need to talk about something. Because y'all med heads like to know it all, but I like to know it all. And so I love it when there's a point where we can all learn something. All right, please make sure, go ahead and give us a like, give us a follow, give us a subscribe, share us. Go ahead, go to that little share area here on YouTube. It's on Facebook too. And please share it in your groups, share it in your WhatsApp, share it in your GroupMe, share it to just a friend, share the link, someone who's at work and they need to watch it on replay. We give evidence-based information. And when you give us a thumbs up, when you share, that really helps us. And if you haven't subscribed already, please subscribe. Again, this is the Dr. Frita YouTube channel. We're up to over 970,000 subscribers. We are steadily trying to make it to 1 million. And please help us. Por favor y gracias. Okay. Now, let's get back to our second weekly dose of headlines, health headlines, where I give you a fresh take on the health headlines you simply can't get anywhere else. I'm normally tussling with RFK Jr., our head of health and human services. I'm normally fighting with him in my mind, just because he's not a doctor, he's not a nurse, he's not he's not in the medical field, yet he has many things to say historically that have countered the evidence. He's been a known vaccine skeptic. He, even with the way that he put his dietary guidelines out, where he has like red meat and beef tallow on the top, there's a lot of contradictions there. And I just believe that he's giving really poor health information in a lot of cases that's making America sick, to be frank. And what I say, I can back up with evidence, including the fact that he has not been really out there forthcoming with the measles vaccine. In fact, he has, even since he's been in this position, put out skepticism. And we see that we've had more measles cases in the past year, in this last season, than we've had in 30 years. Okay. We see that the flu outbreak has been up there, like pertussis. He's done a lot of things that have been anti-health. In this case, however, he's talking about sugar, and he's talking about going after Dunkin' Donuts and after Starbucks because they have really high amounts of sugar in their coffees. And you know what? This might be one time where I'm not going to disagree with him, but I'll see. Let's play this clip and then let's talk about sugar in coffees.
Welcome back. Robert F. Kennedy Jr. is going after Dunkin' and Starbucks.
The Health and Human Services Secretary is specifically concerned with the high amounts of sugar in both companies' drinks, and he wants proof that they're not unsafe. NBC 10's Aaron Logan joins us live in Newton to break this whole thing down for us. Aaron, what are the customers saying?
Well, Colton, as you know, Massachusetts is the birthplace of Dunkin' Donuts, so many people are being protective over any potential digs at Dunks, while others say RFK Jr.'s comments are a real health concern. A lot of sugar in that iced coffee?
I try to reduce the number a bit, but regardless, I think it's probably more than I should have.
So I got an iced coffee, regular with butter pecan.
Dunkin' customers know that's a lot of sugar in one drink, but just how much?
Dunkin' Donuts and Starbucks show us the safety data that show that it's okay for a teenage girl to drink an iced coffee with 115 grams of sugar in it.
These words, stated by Secretary of Health and Human Services Robert F. Kennedy Jr., have a lot of people talking, including Governor Maura Healey, with a short, simple message: come and take it. After all, Governor Healy is the original Dung Queen pictured here in 2024.
Duncan's like the heart of Boston, you know. I feel like that might cause an uproar.
That may be the case for some if Kennedy follows through with his demand by restricting sugary beverages from these chains if they aren't proven safe. Registered dietitian Sandra Zhang says it's important for all chains to be transparent due to health risks for all ages.
This is a very interesting conversation. And I can tell you straight up, if those numbers are accurate, and I think they are in a lot of cases, of 115 grams in a cup of sugar, that is a detrimental amount of sugar, especially if you're someone who grabs yourself a cup of Joe from these places, one of these sweet coffees with all the added sugar every day. So I agree with him on that. Y'all go ahead and mark this in the history books. I agree with RFK Jr. on that. But we're going to talk more about how much sugar is too much sugar. I want you to put a coffee emoji in the chat, please. My wonderful, lovely, smart med heads. Put a coffee emoji and answer this question for me. Is it the responsibility of companies to offer healthy options? Or do we have, as consumers, is that our responsibility? Okay. Do these chains like Starbucks, like Dunkin' Donuts, do they owe it to us? Is it something that should be mandated that they have healthy options? Or do we all need to be big boys and girls? And is it up to us? I'm curious to know what you think about this. So put a coffee emoji and put that in the chat. Now, let's talk about sugar. So he talks about, RFK Jr., about some of these coffees having 115 grams of sugar. Let's put that in perspective. Okay. It's generally recommended, as far as dietary guidelines, that your sugar intake be less than 10% of your daily calories. So if you're on a 2,000 calorie diet, then it's recommended that you have no more than 50 grams of sugar in a day, or about 12 teaspoons. Now that's a pretty generous guideline. When you go to the guideline of the American Heart Association, they're much more stringent, as they tend to be. According to the American Heart Association, the daily recommendation of sugar for women is 25 grams or less. Okay. And then for men, 36 grams or less. So if indeed, if he said 115 grams, oh gosh, if indeed there's 115 grams of sugar in these Starbucks and these Dunkin' Donuts, which I've done some calculations, and I've definitely seen certain drinks that you can mix up and have your extra pumps that go well over 100 grams, no joke. And that's just in one serving. The 25 grams I said for women and 36 grams I said for women, that's in a whole day. So for women, we're talking 6 teaspoons of sugar for the whole day. For men, we're talking 9 teaspoons of sugar for the whole day, according to the American Heart Association. And for children, 25 grams or 6 teaspoons for the whole day. So if that's the case, and we already know that just on average, Americans aren't staying under the 25 and 36 grams. The average American is taking in 77 grams of sugar a day. Already that's unhealthy. So if you have drinks that have 115 grams of sugar in a day, that's an issue, because we know that having high sugar puts you at an increased risk for inflammation, diabetes, living with obesity, heart disease, which of course you're at high risk for strokes, all of it. So the sugar is toxic in high amounts. I agree with RFK Jr. there. But then the next question is what to do about it. One of the things that happens when you take in a lot of sugar, and then that causes your insulin to surge, okay, to try to do something with the sugar to get it into cells. All of the sugar is not going to go into a cell if you're up there, especially more than once a day or even once a day doing 115 grams of sugar. So now you're stuck with hyperglycemia, or high sugar in the blood, which can be toxic to the cells, can put you at risk for diabetes. And if you already have diabetes, give you poorly managed diabetes. And we know that diabetes, yes, it puts you at risk for heart disease, puts you at risk for strokes. I, as a nephrologist, as a board certified kidney doctor, can tell you diabetes is the #1 cause of kidney failure. Okay, it's why most of the people on my dialysis machine are there, diabetes. So the sugar thing actually does ring true. But then the question is, if we know that, we have the knowledge, thank you very much, RFK Jr., we take the knowledge, is it then our responsibility as consumers to go and do our own healthy options? Or should the government step in? Should places be forced to have a healthy option for those to help to lead the little sheep who might not be able to help themselves? Do we have any comments, any coffee cups and comments? Ooh,
absolutely, Dr. Frita.
Yes.
Member Sheila. Sheila says our responsibilities as the consumer.
Very good. But then I have a question, Sheila. Now, you being someone who's clearly, well-read, you pay attention, health is important to you, but is it fair for someone who perhaps does not have the exposure, someone who does not have the education, is it fair for them to show up and just assume that nothing that they're eating is really going to immediately take them out, but then be exposed to 115 grams? Yeah. And I have to be careful of that because I tend to think the same thing as you. But of course, I'm well informed when it comes to health. And so I can decide if I'm going to, do a little something that I know is unhealthy on this day, and then for the other 28 days be healthy. I can make that decision. But especially, too, when you have little teenagers going and showing up and buying things, do we need to have healthy options? Okay. But you say it's our responsibility. Okay.
Member Joyceley Hopeful says we should have the option to choose.
Okay, good. So you think we should have the option to choose? Of course, yeah, ultimately it comes in on us, but yeah, should we have the option? And I remember McDonald's, and I don't even want to get into the chemicals that are in McDonald's food, when they started getting pressure to have salads, to have cool wraps. I don't think they have salads anymore. Y'all can correct me if I'm wrong, but I often wonder, is that because they care about the health? Were there complaints? Or were they saw that, a lot of the world was going toward being healthy? What is the company's responsibility versus the consumer? All right. Ms. Sheila says it's our responsibility. Joyceley Hopeful wants us to have healthy options. Okay.
And then remember Miss B. Wellness, she says, I say both. People want choices and we must be advocates for our health.
Okay. And that's probably just about where you fit, because I bet that if I were able to go back and forth with Ms. Sheila, she probably says, yes, it's our responsibility. But I'm sure she also agrees that a healthy choice would be good. You can let me know if I'm wrong. And then Joyceley Helpful thinks we should have healthy options, but I'm sure she also thinks you should be an advocate. So, okay, that's probably about the good, safe, sweet spot. Yeah. So then if RFK Jr. is talking about doing regulations, is that appropriate? Now, if they really have 115 grams of sugar, and I think that they do in some of these drinks, would it be proper to say, you know what, even though 36 grams and 25 grams is the max daily recommendation, I'm not going to make you go down to 25 grams, but do not have anything more than 80 grams. Like, do not do it. Is that government overreach? These are just kind of questions to have. So I'm curious, and y'all know I'll be following this RFK Jr. story for sure. But meanwhile, let's talk about Britney. Any other comments on this in particular?
Yes, I remember Terry.
Hi,
Terry says there should be alerts or some kind of different label or tag when it's about the recommended amount.
Oh, that's good. That's good. So maybe if they still can do the 115 grams, have a red sticker on it saying this is the danger zone. And by doing this 115 grams, you're like over 5 times above the limit of what the American Heart Association recommends. And sometimes things like that are enough. Because I know for me, once I started becoming a label watcher and looking at salt content, for example, I used to pick up little bags of this and bags of that, chips, whatever, around the house. I didn't care. I'd be on the phone. Who cares? But once I started being a label watcher, sometimes that alert will make you say, do I want this coffee that badly? Or can I get myself, some coffee and just have a little bit of almond milk in it and maybe, a little honey or a little agave, something that might still have sugar, but not as much. It might make you make healthy choices. Incidentally, if just 1 or 2 people or whoever could tell me how do you sweeten your coffee? What do you use as an option for super sweet coffee? Do you do tea? Do you do lemon water? Give me a little leaf, like a little green leaf, so I know you're gonna give me a healthy option, and we'll get back.
As you asked that question, Sheila, actually, member said, what is the best sweetener to buy?
Oh my goodness. We're going to have a whole discussion on that. And I do have some videos on it that you'll be able to look at. So it definitely depends. So we know that straight up table sugar is not the way as far as the healthy choice, but there are things like monk fruit, stevia. There are different studies. We still need more studies because even with some of these artificial sweeteners, one of the things that makes them really attractive is that these artificial sweeteners like the Splenda, the stevia, the monk fruit, is that they don't have the calories. Okay. So you're not getting the weight gain and things like that, but then they're sweet, like way sweeter than table sugar. But Nothing is perfect. So there's pros and cons to all of it. But if I have to give a one, then I would say monk fruit, stevia, those seem to be the lesser of evils if you're going to use sweetener at all. And I'll be honest, sometimes I just don't use any sweetener, but they're the lesser of the evils in my opinion, But I think we should do a deep dive on that. We should do a deep dive on that because I've talked about some studies before, but I'm going to go back and re-look and see where we are as far as the studies and artificial sweeteners. Because I'll be honest, there's an issue with just about everything. Yeah. Okay.
Yeah. Angela says good coffee needs no sweetener. I know a couple people agree with that. I cannot do. I have to have some kind of sweetener.
Yeah, I'm not that. I can do almond milk sometimes or whatever, but Shador, I like do a little bit of my little artificial sweetener in there. I just do, if I'm being honest. And with it having 0 calories, I still do. But you have other people who will do honey, and which still has sugar. Okay, it still does have sugar, and so sometimes they kind of make their choice as far as the lesser of whatever kind of evils out there. All right. All right. I'll tell you, whether you mix sugar with your coffee or not, one thing that you don't want to do is mix drugs with alcohol, because that's what Britney Spears is being accused of doing, because this past week she was arrested for a DUI. And reportedly, she was arrested because they suspected that she had a combination of substances and alcohol use. She was recorded driving at high speeds and driving erratically. And even a representative, according to People magazine, said that, she feels bad about it. She's embarrassed and that she's going to follow whatever she needs to do. So let's talk about dangerous combinations when it comes to drugs and alcohol. And I'm not just talking about illicit drugs. I'm talking about even things like over the counter. I'm talking about Benadryl. I'm talking about your antidepressants like Zoloft, Lexapro. Okay. I'm talking about your ED medicines like Viagra. Yeah, I am. So I'm going to talk about it, but let's go ahead and play this clip. And then when we come back, we'll talk about the most dangerous medications to mix with alcohol.
Oops, she did it again. Britney Spears was arrested for driving under the influence. According to authorities, she was driving erratically, leading to an hour-long chase. Now her own rep is saying she needs help. Jim Murray has the latest.
Was Britney Spears trying to evade arrest? Cops say she was driving under the influence.
The black BMW sedan in and out of lane, now speeding. Black sedan, erratic braking, swerving, and driving with no taillight.
I'm going to attempt to take the vehicle off on Hampshire.
According to police dispatch, Britney was refusing to cooperate with law enforcement on the 101 freeway.
She's refusing to exit.
Party refusing to exit.
Driver is out of the vehicle.
The drama began around 8:30 last night when cops say Britney was spotted driving erratically. They took her into custody about an hour later, and in a dramatic turn, they transported Britney to the hospital where they drew her blood. Britney was said to be crying as she was booked into jail, and she was released at 6 this morning.
Okay. All right. So we're going to talk about medications, not just illicit drugs, but also other medications that can cause dangers. But here's what I want. I'm going to talk about alcohol, but in the chat, I want y'all to give me a wine glass emoji. Y'all, I love emojis. Give me a wine glass emojis. And I want you to tell me a medicine or list some medications, pills, be they over-the-counter prescription, that you think would be dangerous to mix. And of course, a lot of these things are dose dependent, but just in general, tell me some medications that you think might be dangerous to mix with alcohol. And then I'll talk to you about what some of the possible effects could be. All right, so put a wine glass in the chat and tell me medications you don't think it's a good idea to mix with alcohol. Now, for alcohol, we know that it has its own issues, right? When you drink alcohol, it in some cases can be a depressant, okay? Make you kind of mellow out, kind of low. Or in some cases, it can make you hype, okay? It can cause you to lose impulse control. It can cause you to lose coordination, right? It can cause you to make poor judgments, be more aggressive than perhaps you would have been. Long-term, we know that it can cause liver damage, right? Or even acutely, if you have a lot of alcohol, like a binge alcohol, it can certainly cause you to have nausea. It can cause you to have vomiting. Long-term, it could cause, cirrhosis, liver failure, things of that nature. The thing about alcohol is that when it's mixed with certain substances, medications, it's not just a matter of 1 + 1 = 2 as far as the effects. you can have exponential effects, like 1 + 1 = 10. Okay, so alcohol when mixed with substance can really multiply effects, not only behaviorally, but even in some cases, it can cause some physical damage. With Britney Spears, again, they suspect that it was a combination of substances as well as alcohol that caused her that she was under the influence of. And for the chase to be an hour, I'm just thankful that at least reportedly no one was hurt or killed, because we see this and we know her childhood boyfriend, Justin Timberlake, had that issue where he was arrested with DUI. You have even common folks, in a lot of cases are able to afford ride shares like Lyft and Uber. And for common folks, we at least understand that if we can't afford it, perhaps we should stay home. Or if we go out, just don't drink. It feels like it's common, but I guess, not to downplay if someone really has an addiction, which I don't know if Britney Spears actually has an addiction. There's some behavior that's pointing toward that way. If someone has a true addiction, I guess it's easier said than done to say, hey, just stay home, or hey, you're rich, get a driver. I'll be honest, I don't fully understand why someone with a lot of access won't just get a driver, but then maybe it's a case of them just wanting to have freedom and just not always have someone driving them around. I don't know, but I do want to ask you, med heads, what are some medications that you know or even just suspect might be dangerous to mix with alcohol? And I'll talk to you about some of those effects and some of the meds to avoid.
Angela says Tylenol.
Tylenol. Okay. Tylenol, also called acetaminophen. It's something that is metabolized in the liver. Alcohol is metabolized in the liver. And so if you have Tylenol or acetaminophen while you're drinking alcohol, it could multiply the effects of alcohol, make you extremely drowsy. In long term, it could lead to liver damage. So make sure that if you take Tylenol and you're someone who enjoys your alcoholic beverages, talk to your doctor about what the limits should be of the acetaminophen and or of the alcohol. So yeah, Tylenol and alcohol can be a dangerous mix. Good.
Member Sheila says pain medications.
Pain medications, very good, Sheila. And so we know that can be pretty broad. But when we're talking about opioids, Sheila, like we're talking about Percocet, oxycodone, those types of things, heroin, but even just the ones that can be prescribed. If you are taking those with alcohol, it can give you severe drowsiness, and it can even cause you to have respiratory depression, a slowed breathing, and it can cause you to stop breathing. Okay, if you're mixing opioids with alcohol. So that's a very serious, dangerous combination. Consult with your doctor. And I'll tell you, if it's me and I'm your doctor and you consult with me, I will say no alcohol while you're taking opioids. It could lead to alcohol. It could lead to respiratory failure. Very good, Sheila.
Miss Aileen says cold and flu medications.
Oh, now you want to go over the counter, Miss Aileen. Why you want to do that? You're 100% correct. Cold and flu medications. Let's just take NyQuil, okay? So NyQuil, if combined with alcohol, can lead to an extreme drowsiness and even a loss of consciousness and even a respiratory depression, okay? And then the other thing about NyQuil, it tends to have acetaminophen in it, right? The generic for Tylenol. Again, the acetaminophen is metabolized by the liver, so is alcohol. And so that could potentially lead to liver damage. So if you're taking NyQuil, which is just an over-the-counter medication, it is recommended that you not mix it with alcohol. That was good.
Marcia says rum and Motrin.
Rum and Motrin. Okay, so Motrin is an NSAID, right? A non-steroidal anti-inflammatory drug. So the NSAIDs are Motrin, ibuprofen, Aleve, naproxen, meloxicam, Celebrex. It's a long list of NSAIDs. And you are correct. The NSAIDs, when mixed with alcohol, can increase your risk for bleeding problems or even stomach ulcers, okay? And so definitely, if you're someone who's been placed on NSAIDs by your doctor, and of course, please be careful. If you're someone with CKD, chronic kidney disease, it is recommended that you limit your NSAIDs, okay? Consult with your doctor or do a telehealth visit. Consult with me. That's real serious. But if you are taking NSAIDs, consult with your doctor because mixing them with alcohol could lead to stomach ulcers and bleeding problems.
All right. Jacqueline says antihistamines.
Antihistamines. Okay. So we're getting back to some of these over the counters like Benadryl, right? So if you're someone who is taking Benadryl and alcohol, then guess what? Yeah, that could lead to extreme drowsiness, and even cause a depression in breathing. So mixing antihistamines with alcohol can be a problem, even some of these allergy medicines. So consult with your doctor. That's good.
That's a good one here, Dr. Frita. I am paralegal.
I'm paralegal.
We haven't seen her in a while.
Yeah, we miss you.
Mouthwashes, Vicks liquids, meds with alcohol are those that make you made for depression or make you depressed.
Okay, very good. Okay, so yeah, so anything that already has alcohol in it, absolutely. If you're drinking while you take it, that could be a multiplier. Anything, and yes, some mouthwashes do have alcohol in them, so it's also important to look at the labels. And a lot of labels will tell you, do not mix with alcohol or do not mix with ethanol. Okay, the drinking alcohol. So that is good. Meds for depression. You said meds for depression?
Mm-hmm.
Come on, I'm paralegal, as per usual, to the front of the class. Absolutely. So there's certain antidepressants like TCAs, tricyclic antidepressants like amitriptyline. If you mix that with alcohol, it can lead to passing out, to blackouts. And then there's the real popular antidepressants, the SSRIs, selective serotonin reuptake inhibitors, like Zoloft, Lexapro, Prozac, all of these anti-anxiety, antidepressant medications, which are very effective, you know, for most people as far as being antidepressants. But guess what? If you mix them with alcohol, do you know that can actually worsen your depression? Say what? Yeah, it can worsen your depression, and it can even lead to issues with dizziness, with loss of coordination. Okay, imagine getting behind the wheel with dizziness and loss of coordination, and long-term, even liver damage, or acutely, depending on the amount. So yeah, so if you're someone who takes an antidepressant, don't hide it from your doctor. If you have, you know, a couple glasses of wine on the weekend or a glass of wine, just talk to your doctor and have an honest conversation on what the most reasonable combination, if any, would be, or if you just need to not have any alcohol at all. But yeah, mixing those could definitely be a problem. Good.
All right, a few more, Dr. Fisher. I think you're hitting all the class of medications. Candy, hello. Candy says muscle relaxers.
Muscle relaxers. What happens if you've ever had back pain or your doctor gave you a little Scalax and a little muscle relaxer? What happens? You get drowsy, right? They tell you don't operate machinery with the muscle relaxer. You more likely than not, you take it at night because you're drowsy. So you can imagine if you mix that with alcohol, you could go into a sleep that you never wake up from. Okay, so it is not recommended that you mix the muscle relaxants with alcohol. It can lead to extreme drowsiness, loss of consciousness, even permanent loss of consciousness, respiratory depression. Very good.
All right, got two more here. Blue butterflies.
This is fun. I love it when y'all pretend to fate. Okay.
Blue butterflies says statin drugs and high blood pressure meds.
Okay, and there are certain statins and high blood pressure medicines. Now, remember, when I'm saying this, okay, let's be official. There was one point when the CDC recommended a moderate or safe amount of alcohol. Since then, researchers has shown us that there is no safe amount of alcohol, meaning even in moderate amounts, like a drink a day for women or a couple drinks a day for men, it is possible that can increase your risk for cancer and other illnesses. So I say that to say there's no safe amount of alcohol. But if you're someone and you've made your own personal decision that you're going to drink and you're going to drink in a moderate amount, then have the conversation with your doctor, because I'm not giving you absolutes here, but I am saying that when you, with blood pressure medications, with statins, especially if you drink high amounts of alcohol, or if you're in high doses, it really can multiply and increase your risk for illness. So yes. Yeah, I'm not telling you absolute not, but have that conversation with your doctor. Mm-hmm.
All right, Adija. Weight loss medications. We haven't hit that one.
Okay. Ooh, okay. So there are certain ones like, metformin. I know that's a diabetes medication, but also for some people, if you take metformin, it can decrease your weight by 10%. And it is not recommended that you take metformin with alcohol. As far as the GLP-1s, there can be an interaction, that slows down how you empty, and in some cases, how you metabolize, how you absorb. And so there is a possibility that it can change the way that alcohol affects you. I'm not telling you absolutely not. That's not what I'm telling you, but I am saying have a conversation with your doctor before mixing weight loss medications with alcohol. Good.
All right. And then Jetty. Xanax.
Hi, Jetty. Xanax. Come on to the front of the room, Jetty. Let me tell you right now, Xanax, Valium, Ativan, these are the benzodiazepines, okay? And when you mix those, yes, it can cause dizziness. Yes, it can cause loss of coordination. Yes, it can cause extreme drowsiness. And you have a very high risk of overdosing if you combine alcohol and benzodiazepines like Xanax. So that is a no-no. That's what I tell my patients. You consult with your doctor, but what I'm telling you is so. Mixing the benzodiazepines like the Xanax, Ativan, Valium with alcohol is a recipe for disaster, and it can lead to overdose, among other things on the way. Very good. Word up. Okay. And then just another couple interesting ones, because the list it can be endless, but another important one, ADHD meds. Because now we know not only, our kids and teenagers being diagnosed with ADHD, we have adults diagnosed with ADHD. And so taking things like Adderall and Ritalin with alcohol can be a dangerous mix. And you heard Ray J, he was like, I've been taking Addies and drinking bottles of alcohol. Guess what? The mixture of ADHD meds and alcohol can lead to heart problems. And we know Ray J has a cardiomyopathy. And it also, interestingly, you're taking these medicines to help you focus, but if you mix them with alcohol, it can actually decrease your focus. Okay. So that's another combo not to do. Yeah. So actually I did a short form content. If it's not on YouTube right now, it will be likely on Britney Spears and then the combination of meds. Also on my other social media platforms, my watchers watching me from Facebook and everywhere. You can go ahead and check that out now. I posted it last night on the most dangerous meds to mix with alcohol. Make sure you share it, because a lot of these things aren't common knowledge, right down to Viagra, Cialis. If you mix those with alcohol, it's possible to lead to a dangerously low blood pressure that can take you right out of town. Okay. It can take your life. And so just make sure you share this with people you care about. Once you take a look at the short form content, and share this live here, Dr. Frita Live, with people you care about. We're always here. We're giving you evidence-based information. And, alcohol, yes, with the Viagra, it can lead to dangerously low blood pressure. Alcohol itself can increase your risk for high blood pressure. So make sure you get my book, Under Pressure, A Guide to Controlling High Blood Pressure. Click the link in the description or go to my one-stop shop, drfrita.com. I give you not only the traditional ways to manage blood pressure, but also we talk about holistic ways of managing it. Okay. And so I definitely want to thank everyone who came to join to the MedHeads. Any last question or last word on the way out the door?
Yes, ma'am. So shout out to new member, April.
Yay. Thank you for joining us. I got some videos lined up for you. So I dropped today. Go and take a look. Thank you for being a part.
All right. And then you asked earlier about questions about the kidneys or.
Yeah. We'll take a couple of those.
If members have any questions.
Okay.
So I'll start with our member, Terry.
Hi, Terry.
Terry says, a few weeks ago, a 37-year-old family friend suddenly passed away from an unknown or undiagnosed aortic tear. Can you talk about this?
Number one, if you are a member at the resident level or above, that's really something you mentioned. That's exactly what I talked about in the members only video today. That's exactly what I talked about. And that kind of gives me chills that I had no idea that you would be asking this question, because I had a 40-something-year-old person who thankfully didn't pass away. But what you're talking about is aortic dissection, and having unmanaged high blood pressure will put you at risk. So you have your heart and it pumps into your aorta, which is the largest artery in your body. It kind of humps out, coming out of the left ventricular chamber, the left ventricle. And it has the most pressure, right? That big artery. Well, if you have a tear within the wall of the aorta, then with each pump that the heart makes, then that blood, instead of just going inside of the lumen, inside of the tubing of the aorta, it will go inside of the wall, inside of the tear. And so then what happens is, instead of your body getting all the blood flow and oxygen that it's supposed to, is getting trapped inside of the wall. That's the aortic dissection. If that keeps happening, then you're going to cut off blood supply to the brain. You can get a stroke. You cut off blood supply to the other tiny arteries in the heart. You can get a heart attack. You cut off blood supply to everywhere in your body, and you can pass away from aortic dissection. The biggest risk factor is going to be high blood pressure. And so when I talk to y'all about Under Pressure, A Guide to Controlling High Blood Pressure, it's not just talk, and a lot of people don't have symptoms because it is a silent killer, but we watch people pass away from things like aortic dissection, even at young ages. And the other thing is, with that 37-year-old, of course, most likely, and I'm sorry about your loss. I'm sorry about your loss. Most likely it is going to be high blood pressure. Sometimes people, if they have certain connective tissue diseases like Marfan, certain genetic components, there could be a genetic predisposition to getting an aortic tear. But what you're talking about is aortic dissection. And thank you for being a member. If you happen to be a chief resident or a resident member, then check out the members only video I posted today. I promise you, I talked about aortic dissection in a young family member of mine who had it. Yeah, that's just really interesting that question came today. Yeah.
Absolutely. All right. Member Colette.
Hi, Colette.
She says, my sodium is very low in my blood.
Sodium is very low in the blood.
Yes.
Okay. So sodium or salt can be low for many reasons. It's not likely because you're not eating enough sodium. A lot of people who have low sodium, it's like, oh, I better eat more salt. I better eat more salt. No, that's typically not the first answer. And of course, you want to consult with your doctor. But oftentimes when the salt is low in the blood, it could be because the salt is diluted and you might have volume overload, meaning too much fluid. If you have swelling of your feet, swelling of your ankles, maybe a little swelling in the lungs causing shortness of breath, then you might literally be holding on to fluid. And that's why the salt seems low. It's diluted and so it comes out as low. If that's the case, then consult with your doctor and find out why. Is it because you're just retaining water and you have high blood pressure also? You need to take a water pill to get rid of it. Is it because you have kidney failure and I'm not speaking this on you, I'm just talking about in general, what happens with low sodium? Are you holding on to water because your kidneys aren't getting rid of enough fluid? In which case you need to get to the underlying kidney issue and then perhaps also be on a water pill or diuretic. And do you have congestive heart failure? Is your fluid backing up because that heart is not pumping out enough blood? And is that causing you to have it? Other things that can cause low sodium could be if you're not eating enough. And this happens a lot of times in my elderly patients who maybe just eat tea and toast. They don't eat a lot of solutes. They don't eat a lot of protein. You have to eat a certain amount of food, a certain amount of protein solutes. You have to have a healthy diet in order for your kidneys to get rid of enough water. If you're someone who is quite malnourished, you're just not eating very much, you're eating mostly things like tea, toast, bland things that don't have a lot of substance, then sometimes that can cause you to have a low sodium. Other things that can do it, medications, diuretics, okay? Certain water pills can cause you to have low salt in the blood. Some anti-seizure medicines can cause you to have low salt. What's going to be very important is for you to consult your doctor and to know your numbers. So normal sodium by most labs is like 135 to 145. If yours is like 133, 132, that's probably not an emergency. It's not an immediate emergency, but you need to find out why it's low. And then certainly if it's in the 120s, like 125, well, now we're getting into urgency, emergency category. So if you have low salt, I definitely want you to find out what that number is. Your doctor might have you do fluid restriction. Okay, if it's a matter of being too much, I'm not diagnosing you over this question, but I am saying go consult with your doctor sooner rather than later to find out the cause and then the treatment of your low salt.
All right. Thank you, Dr. Frita. And now in with our super chat from JT.
Oh, thank you, JT. I appreciate you for the super chat.
JT says, thank you for your videos. So helpful.
Oh, thank you. I appreciate you, JT. That support really does mean a lot. Thank you. Thank you. And I thank you to all of you who joined us today on Dr. Frita Live, where we talk about the latest trending medical headlines and celebrity health news. And hey, we do question and answer sessions, don't we? So happy Kidney Disease Awareness Month. Please share this video. Please make sure you give us a like, a subscribe. Please check me out on my one-stop shop, Dr. Frita Live, where you can see my blog posts. You can check out my favorite things, where I give you my favorite juicer. I give you a discount code also. I give you my favorite blood pressure cuffs. You can buy my book, Under Pressure, Guide to Controlling High Blood Pressure. You can see my latest television appearances. And also you can see like where I was just on Don Lemon again last week, talking about the Trump's red rash. At any rate, I certainly appreciate y'all. Make sure you subscribe if you haven't already. Share this information, encourage other people to subscribe because we're trying to get to 1 million. Okay, comprendes, gracias. Okay, adios. I'll see y'all next week. Same bat time, same bat place, Monday noon Eastern Standard Time. And again, I'd like to thank you for making Monday your healthiest day of the week.